So some of the stress reduction approaches are, some of them are pretty simple. Some of them are probably things that you're probably already doing. We'll kind of talk them through as we go. But the key is to, and this image, I think, really hones in on do what works. So you all are going to know how you deal with stress best. And so what has worked in the past is what exactly you should be doing currently. So if you know that sitting down and reading a good book is a way you distress, then do that. If you know that meditation or yoga is your thing, get back involved with that. Try to figure out, do you need to manage your time better? Are you missing that were you regularly an exerciser, now all of a sudden you're not? Can you find a way to incorporate that? Get some relaxation, eat a good diet, sort of all of these basic things, kind of take care of yourself more generally. This is just kind of a general, do whatever works for you. One thing that I think is really, really important, as far as we preach all the time, like use your social support, use your supports, is to manage your expectations as far as what you're going to get back from your support, because not everybody is great at providing all kinds of support. So if you think about the people in your life who provide you support, think a little bit about like where these people fit in. So this breaks it down, this graphic breaks it down into 4 types of support. So emotional support, practical support, information support, companionship support. So the emotional support are the people who really can listen, validate your feelings. They're not necessarily trying to jump in, change things, tell you what to do. They're just purely there to be an emotional support, to listen. And some people are really, really great at this. Others aren't so great at emotional support, and maybe they're better with the practical support of things. So those are the people that are bringing you a meal, offering to, take your kids to soccer practice, or helping out with chores, or just really getting in there and doing more of the practical things that you need. Some people are better with the information support, so those are the types that have really good suggestions, they have great advice, maybe they've been through it before, and so they have information to share with you. And then you have that companionship support, just somebody to be with you, to spend time, to do something fun with you. You have to kind of think about, okay, if I'm asking for support, if I really need that emotional support, calling up the practical support person probably isn't going to be so great. So utilize people for what they are experts in, I guess, so to speak. I had a patient the other day tell me that I shared this with her, and she was like, oh, I have a food support. So she has a friend who is a chef, and he does all of the cooking and brings meals like every day, all day, and she's like, this saves my life. Like, I would be lost without my food support. There are all kinds of different supports you can probably think of. Like, I like to think of somebody being like a kind of a normal support, somebody that you can just talk to and talk about everyday things. Like, sometimes it gets to be a lot, always talking about illness or, oh my gosh, all the stressors in life. So having that person that can just kind of shoot the breeze, and occasionally I feel like we have those friends that no matter what's going on, when you call them, they're going to tell you about their problems. And maybe sometimes you need that. Maybe sometimes you just need a distraction, or you need a reminder that you are still a friend too, and you can still provide support to your friends in other ways. You don't want to take on too much or be more burdened, but it's just an example of lots of people can provide lots of different support. So be sure to kind of think about your expectations and what you're asking or expecting from people based on kind of what they're good at.